Hi everyone. So today we are going to learn about a very underrated but a very important joint, which is temporomandibular joint. Okay, so it's just between the skull and the jaw. And if you have to palpate this joint, how will you do it? You put your fingers in front of the ear, okay, in the preauricular region, and you make the jaw movements. Then you will feel some movements. That, or you can either put your fingers into the external acoustic meatus. You can do it yourself. If you put your fingers into the external acoustic meatus and you feel some jaw movements right there, that is the temporomandibular joint, and that's how we can palpate for the movements in the joint. Okay, so first, so yeah, this is what I mentioned before, and there is going to be rotation first and then translation, meaning sliding. Remember this, and it will be useful in the future movement videos. Okay, so I work hard every day, but nobody appreciates me. So this will be the statement of temporomandibular joint. Okay, right. So so this is the lateral view of the skull, like you're seeing my face, and in this region we are having this bone. Like this is the temporal bone, this is the squamous part of the temporal bone, and here we have the zygomatic arch, right? And here this is the mandible, and here this is the external acoustic meatus. All right, and behind we are going to have this mastoid process, and this region of the external acoustic meatus is formed by a small plate of bone which is called as tympanic plate. Okay, so here this joint is the temporomandibular joint. Okay, now we have to know a few landmarks, bony landmarks, to know the articulating surfaces. So here we can see in the zygomatic arch we have an elevation like a tubercle, that is called as articular tubercle. Okay, and then here there is going to be a depression which will be called as mandibular fossa, and here below we have this head of the mandible. Okay, so these are going to participate in articulation. And if you see this external acoustic meatus, anteriorly it's bounded by this tympanic plate, and in between these two bones, that is the squamous part of the temporal bone and this tympanic plate, there is going to be a fissure at this junction point, that is called as squamotympanic fissure. Okay, between the squamous part of the temporal bone and the tympanic plate, so it's called as squamotympanic fissure. Okay, this is these are the few bony landmarks. And if you see the inferior aspect of this skull, here again we are able to see this is the zygomatic arch, and behind here we have this articular tubercle, and this region, this oval shaped fossa, is called as the mandibular fossa. Okay, now let's see the introduction of this joint. Okay, what type of joint? Any joint, what's the first thing we should know? What type of joint, and if it has a specific variety, and which variety it belongs to, right? So our temporomandibular joint, otherwise I'm going to mention it as TMJ, it is a synovial type of joint, and it is going to be of condylar variety. Okay, it is going to be of condylar variety, and again it is going to be a complex variety of joint. In general anatomy we would have learned about simple, compound, complex joints, right? So here we are going to have a complex variety of joint. So what are the articulating surfaces? So above and below. Okay, so the superior articulating surface is formed by the articular tubercle, and behind it is formed by the anterior part of the mandibular fossa. Okay, so that is the superior articulating surface, and always remember the posterior part of the mandibular fossa or the tympanic plate, they are not going to form the articulating surfaces. Okay, whereas inferiorly the articulating surface is going to be the head of the mandible, and both these articulating surfaces, they are going to be lined by a cartilage. Okay, usually it is lined by hyaline cartilage, articulating cartilage, right? But here it is lined by fibrocartilage. Okay, so it's going to be lined by fibrocartilage, right? Next, as you can see in this picture, if you can appreciate it, this is the head of the mandible, this is the zygomatic arch, and this is the TMJ. Here we can see both the articulating surfaces which are lined by this fibrocartilage. Okay, and do you notice something else also here in this joint? And here we are going to have this synovial cavity which is divided into two by a disc. This disc is called as articulating disc. Okay, so we'll learn about that more in a bit. Now, so after knowing what type of joint it is and then what are the articulating surfaces, then we should know about the ligaments which are supporting around that joint before moving on to the next, right? So regarding the ligaments, so first one by default in any joint, it's going to be its own fibrous capsule. That will be the most closest and the most original one for that joint itself. Okay, so it's either called as fibrous capsule or called as capsular ligament, right? So here we can see this is the fibrous capsule, and this fibrous capsule is attached above to all the circumference of the mandibular fossa, anteriorly to the articular tubercle, and posteriorly to the fissure which we learned earlier, right? That will be the squamotympanic fissure. So above this is the attachment, below it is going to be attached around the neck of the mandible. Okay, so this is going to entirely cover the joint and protecting it, right? Next, and lateral to that, so after this, whatever ligaments we are going to have, there will be like main supporting ligaments and there will be accessory ligaments. Okay, so here we have the main supporting ligament, the very very important support laterally, so that it doesn't displace laterally. That ligament is called as lateral ligament. Okay, and it is going to extend from the articular tubercle to the posterior border of the neck of the mandible. Okay, so this is the lateral protection. Next, apart from this, we have three more ligaments actually. Number one ligament which is going to extend from this process. Okay, so can you see this process? This is called as styloid process. Okay, the most prominent one, which is going to be like a very sharp horn, that is called as styloid process. So from there to the mandible, that ligament is called as stylomandibular ligament. Okay, so it's going to extend from the styloid process till the angle of the mandible. Number one, that is the stylomandibular ligament. Next, we have another ligament which is called as sphenomandibular ligament. Like just medial to this head of the mandible, at the base of the skull, we'll have a small process. Just like this styloid process, which is longer, there is going to be a very short process which is called as sphenoid process. Okay, so from there till the mandible, in the mandible, we have this opening. Can you recall what is the name of this? It is mandibular foramen. Okay, so and just around the mandibular foramen we have a tongue-like projection, isn't it? That's called as lingula. So this ligament is going to extend from the sphenoid process till this mandibular foramen lingula. Okay, so now you should remember, here we can see a split when it is attaching. Can you recall why? Because within this foramen we are going to have the inferior alveolar vessels and nerves entering, right? So they are going to like just go across this split and enter into the mandibular foramen. Okay, so this is the next ligament. Finally, we have some ligament called as pterygomandibular ligament. If you have studied about the skull base, we will have a medial pterygoid plate and a lateral pterygoid plate, and at the medial pterygoid plate there will be like a hook-like structure called as pterygoid hamulus. Okay, so from there, like around in this region, we'll have the pterygoid hamulus. From there, one ligament is going to extend till the third molar teeth. That is called as the sphenomandibular ligament. Okay, so far we have learned about what type of joint it was and what are the articulating surfaces. Now we are going to see about the ligaments related to it. Number one, it is the capsular ligament. Number two, lateral ligament. Number three, everybody, all the three ligaments will be going towards the mandible, starting from three different points. Number one, stylomandibular. Number two, sphenomandibular. Number three, pterygomandibular. Okay, so these are the different ligaments. Okay.